Now, there's a fourth wave sweeping the continent, with countries like Austria, as I've said, recording record numbers. How worried should we be about that surge in infections on the continent?
Well, we're all looking with grave concern, actually, and trying to determine whether there are differences in the situation in Europe, or whether it's just a matter of time until this faces us here. I mean, just briefly, to be a bit more optimistic, there are some reasons why there might be a different trajectory. Delta, the variant we're dealing with now, became dominant, particularly in Central Europe, later than it did in the UK. We opened up a little bit earlier, particularly in England, and so we dealt with our Delta wave in the summer and early autumn. We're still in it, of course, but not those big rises. And then the other features are around, unfortunately, because we've had high infections in the past, we've probably a bit more natural immunity in the population, as an immunity post-infection, particularly for younger groups who've not been eligible for vaccines. And then the other thing is that the vaccine rollout in Europe, if you look at the population level, these countries you're talking about, Netherlands, even more vaccines than us, Austria, a little bit lower, Germany, roughly similar, but they deliver their second doses earlier for many older groups. So they're certainly seeing waning now, and they've also got, in some parts of the population, some pockets of hesitancy which are causing real concern. So we may not be the same, but, you know, it's very uncertain.
Well, I want to come to the issue of waning immunity in a second, but before we get there, I mean, in a way, there's an example much closer to home for us in England, and that is where you are in Scotland, where, in spite of what you said about the factors that might lead us to be more optimistic, the Scottish government has essentially been tougher, particularly in relation to transmission risk, and has taken steps to reduce transmission risks, which are not being taken in England. Does that worry you? Should we in England be following the example that you have in Scotland?
Well, I think if you look across the devolved nations, actually, Trevor, throughout this pandemic, there have been slight differences. I mean, let's just look at face coverings, for example. You're right, that is still required up here, as it is in Northern Ireland and Wales, in some settings that it's not in England. And if you look at the surveys, people are far more likely to report they are wearing them here, even though I don't think compliance is 100% by any stretch. So that's a factor. We still have stronger advice to work from home. And then, of course, we have a modest certification scheme. Wales has just expanded theirs on Monday. I mean, we've continually had this question about should the UK use the same approach across all four nations. My personal view is it's confusing when the guidance is different. But on the other hand, the devolved nations have authority in relation to public health and indeed the NHS. It's a devolved responsibility. So we'll see. At the moment, if you look at the ONS infection survey, levels of infection in Scotland are a bit lower than they are in England. We've got real concerns about Northern Ireland. It's really difficult to make those direct comparisons. But of course, I would prefer that people were wearing a face covering in public places and trying to follow those protective behaviours to keep themselves and others as safe as possible.
Can you talk to us about this issue of waning immunity? What's the evidence that the protection offered by double jabbing is waning in a meaningful way, or a way that should affect policy?
Well, you've got two different types of evidence there. The first one is real world, where you can look at large epidemiological studies that just show what the risk is of being infected, of becoming unwell and going into hospital, depending on the duration or between your second dose and when that event occurs. And you can see that those who had their second doses earlier, there's more evidence of waning. You also get that from studies like REACT, where they're looking at a random sample of people in the population who are swabbed. That's one source of evidence. And then the second, of course, is from the trials, the Pfizer trial, for example, where they looked at the effectiveness of boosters. They were able to look at some of those features. So it's very clear that there is waning. It's not uniform across groups. But obviously, people have more vulnerabilities if they have underlying health conditions or they're older, and those groups got the vaccine first in most countries. So I think it's pretty clear from that evidence, and also from the studies that have been done in Israel, for example, looking at what a booster can do, getting that protection, for example, from antibodies for, say, 50%, 6 months post-second dose as it wanes, right back to over 90%. And that's what we're trying to achieve here in the UK.
Well, it's evident now that everybody thinks that the booster is important, and in fact, there's some suggestion that the booster gives you better coverage. I've had mine. I guess I'm now told that I'm 93, 95, 96% protected. Is this now going to become part of our life, like the flu jab, every year, that we're going to have some kind of booster against COVID?
I think that's scientifically uncertain at the moment. I'm not a virologist or an immunologist, but speaking to those colleagues, it's pretty clear that that is a possibility. The great thing about the boosters, Trevor, and I cannot emphasize enough the importance of people taking up that offer or going online for people in my age group and booking their appointment ASAP, 6 months second dose. Please, please do it. It's the key for this winter. Is that it kicks in almost within 7 days if you look at some of the studies. Or we have an immune memory that responds again to that vaccine. It's possible, like influenza, as you point out, that we will have repeat delivery of boosters in future, particularly for older age groups. But we don't know that yet. We need to study in real time the effect of these vaccine programs and see what happens. But back to the first question you asked me, if we can really continue to deliver boosters at scale, we can continue to be cautious in our behavior and try and adopt those protective behaviors, even if they're not mandated everywhere. I'm really hoping we can, despite what Chris said about the huge pressures on the NHS, get through this winter without it being a disaster and without us having the situation we had last Christmas.
The Health Secretary rather dismissed my question that essentially, in truth, what the government's doing, even though it's not called this, is pursuing a strategy of herd immunity. Of course, that's become a sort of dirty phrase, but in truth, that actually what they're hoping is a combination of induced immunity and natural immunity will, as you just said, protect us through this winter. Now, he's got to say that because he's a politician. You don't. Is that in truth what's happening here?
I think if you look at children, there certainly has been a strategy just to allow this infection to go through our young populations. That's very clear to me. Different governments around the UK have had different views on that. And of course, we've had to follow the guidance of experts on the JCVI. But I think, if you look at the minutes from that committee in terms of the decisions that they took, they have huge expertise. But if you look at the minutes and if you look at some of the narrative, particularly at UK level, it certainly has been the case that this is a mild infection in children. It's probably better that they just get it. I don't think that's been a strategy for older age groups. We're worried about long COVID. The risks are not zero to young people. I would like 12 to 15-year-olds to be able to have their second dose. I would like us to consider what's happening in the US with vaccines for younger children in the long term. I think to have protection through vaccination, if it's safe and irrespective of age, is far preferable to allowing it to happen just en masse through natural infection.